We're talking about prisons and jails, and I do want to take us now to Texas and Keri. Keri, is it Blakinger or Blackinger? I'm sorry.
It's Blakinger.
Blakinger, thank you for that. With the Marshall Project to talk about the inmate and prison population. I heard Rudy Giuliani, the former mayor of New York City, say the other day, leave them in there. There's no reason to bring them out. What's your reaction when you hear that?
Well, I think that it's pretty well understood that people in jails and prisons don't really get good medical care. But it's also an issue in terms of it's a lot easier for these things to spread in a prison or a jail environment because you really just can't do social distancing.
I think Texas had an inmate test positive. If that happens, what's the course of action? Do they go into isolation? Tell the story of that.
So what Texas is doing is the one, and this is for the state prison system. There's also been some positives in the Dallas County Jail, and just today they confirmed that there was a juvenile in the Harris County Detention Center that has it, the juvenile detention center here that has it. But in the state prison system, there's one confirmed positive among the inmates, and that person's been medically isolated. So that looks a lot like solitary confinement, but it's in a prison medical hospital setting. The rest of the dorm, the other, 57, 58 guys that had been living with this person are all medically restricted. So they've basically just quarantined that dorm. So that's sort of how Texas is dealing with it. But at some point, if this becomes more widespread, that could be problematic to do just based on the amount of dorm space versus cell space that some of these facilities have.
Yeah, I was going to say, where do you put them? Where do you put these individuals?
It depends on where they're being housed and how many cells and how many dorms there are. But also, I asked the prison system, like, okay, if you end up with a lot of people that are positive, like their hospital, they have a hospital ward in Galveston, but it's not that big. And I said, like, okay, what happens if you have a large number of positives? Like, what are you going to do with that? And they said they had a plan and that it is a good plan, but that for security reasons, they couldn't share it.
Now, some prisons use those private companies for healthcare. Is there any concern about that part of this story, and that maybe the public doesn't or is not able, I guess you could say, to keep track of the care that they're getting in those facilities?
Well, I think it's really hard for the public to keep track, regardless, whether it's contracted out or whether it's something that's provided by the facility, or as in Texas, we have it that the providers are University of Texas Medical Branch and Texas Tech. So it's university-based, like hospital or medical care providers. But regardless of how you do it, it's difficult to track. Privacy laws vary by state in terms of what can be released about specific inmates, which can make it hard to verify some of the claims that you get. But as a whole, it's not good. Prisons and jails are not typically, even if it's, whether it's contracted out or whether it's done themselves. You can just, wherever you are, you can just Google when the last time your jail was sued over bad medical care, because it's probably happened.
Hey, Keri, what about families in visitation? I guess this also depends on what state you're in, but visitation rights. The important times to bond for an inmate and have their family come and visit. Are people being allowed to still see inmates?
No, they're not. Many jails, I think all of the jails in Texas, any of the prison systems that I've been looking at, they've all cut off visits. And that's not to say that that's something that's unmerited. Clearly there's risks of that. Of having visitors coming in and out of these facilities. The same risks that, having COs come in and out every day also presents. But of course, when you don't have visitors coming in, that makes it harder for people to reintegrate afterwards if they don't keep up these family bonds and maintain family relationships. And, it's also, it can pose a risk in terms of violence. Like, people have less incentive to behave if they aren't worried about losing their visits. The person that sort of holds them down and keeps them from just sort of losing it might not be able to see them for a while.
Yeah.
So, when you take away visits, it tends to have pretty clear and sometimes very immediate impacts on behavior and, risk and violence within these facilities.
All right. All important conversation here right now with Keri Blakinger with the Marshall Project. Keri, thank you very much for your time. I appreciate it.
Thanks for having me.
Of course.